Those are the key measures that need to be observed in order to break the cycle of spread of this virus. Now, when we come to testing, today we have tested 2,000, over the last 24 hours, 2,419 samples, bringing to a total the number of tests that we have so far conducted to 108,666. Of these 2,419 samples tested over the past 24 hours, 90 have returned positive for the virus. And this number now brings the total number of COVID-19 positive persons cumulatively to 3,305. All the positive cases are Kenyans. 62 of them are males and 28 are females. The youngest is 14 years old and the oldest is 80 years old. These 90 cases are distributed in the following counties. Nairobi recorded 36, Mombasa 34, Busia 12, Uasin Gishu 3, Kilifi, Garissa, Kisumu, Meru, and Turkana 1 each. By sub-counties, the Nairobi cases are from the following areas: Kibra 12, Makadara and Mathare 5 cases each, Kamkunji 4, Langata 3, Westlands and Embakasi Central 2 each, Dagoretti North, Embakasi West, and Embakasi South 1 each. In Mombasa, the 34 cases are from Mvita 14, Kisauni 8, Likoni, Jomvu, Changamwe 4 cases each. In Busia, all the 12 cases are of truck drivers at the Malaba border point. Garissa's 1 case is from Garissa Township. Kilifi's 1 case is from Kilifi North, and Kisumu's 1 case is from Kisumu Central. Meru had 1 case from Imenti Central, and Turkana 1 case from Turkana West. Unfortunately, we have also lost 4 people from the disease, which now brings the total number of people who have succumbed to this disease to date to 96. We send our heartfelt condolences to the families and friends of the departed. As I conclude, I want to extend my appreciation to all individuals, groups, and companies that have partnered with the Kenya National Blood Transfusion Services in this campaign. Once again, I want to appeal to all Kenyans to come out in large numbers and donate blood in order to save lives of others. Finally, I want to remind Kenyans that we must strictly observe the COVID-19 containment measures because they are the only known modes of behavior to successfully fight the virus. And as I finish, I would also want to urge those of us who are here, including my entire team, that we support this campaign by walking over to the tents when we finish and donating blood. Thank you.
Okay. My name is Chemutai going from Citizen TV. I have 2 questions. One regarding, of course, what you've spoken about, blood donation. There's a lot of perceived politics, blood politics. Some people go to hospitals and are forced to part with money before getting blood. first address that matter, and possibly what are you doing to change the attitude of Kenyans who prefer to wait until they have a relative in hospital to give blood than just give willingly? And just a clarification, after the extension of curfew from 7 p.m. to 9 p.m., what does this portend for restaurants which were supposed to close at 4 p.m.? There's a lot of, there are some that are opening late into the night. That matter is not clear. Thank you.
My name is Purity Musa from KBC on the home-based care program for COVID-19 launched on Wednesday. Do we have so far any patients that you've released that are positive cases that you've released and are under this program between Wednesday and today?
My name is Helen Aura from NTV, still on the home-based care procedures. What measures are the ministry ensuring that this home care-based workers, will they be doctors, just a clarity, will they be doctors, will they be nurses, or will they be just healthcare volunteers who will be deployed to the homes? And what parameters will you put in place to also ensure that these same home care-based workers will be safe also from preventing this contraction of the virus? My second question is, NTV had reported a memo regarding the transfer of some workers within the ministry, or even just the health ministry at large. And it came to note that some of this transfers, some of these officials refused to be transferred. What is the ministry doing regarding this particular matter?
Okay, thank you. Chemtai, I think what you were saying in a different way is that, and we have seen it in the media on several occasions, that there is some level of possibly corruption, as you may call it, within the services or blood services. A number of issues, of course, have been out there in the media regarding the operations of the National Blood Transfusion Services. These are issues that have been brought to the attention of the ministry, and I think all of you are aware that there are some processes that are ongoing right now. Even as we speak, there are investigations that are being undertaken to try to establish exactly what is happening or what the veracity of some of these issues are. So I think we are also, as a ministry, very eagerly waiting to see what is unearthed. But clearly, as I had said, we, as a ministry, are moving forward in a program of reform of the Kenya National Blood Transfusion Services. Those reforms are going to be widespread, including looking at the legal structure, as I mentioned, but also focusing very strongly on governance and leadership issues. So as this information becomes available, I'm sure we will be able to share it with you. The intention here is if there are any problems in the system, we need to clean it up, and we need to make sure that that facility functions the way it was intended to and provides the services that it is required to provide. The attitude of Kenyans in terms of coming out to give blood. We have repeatedly said, even in this COVID-19 campaign that we are conducting, that matters health touch on each and every one of us. Even though we may not be affected, they will touch us. The COVID-19 touches each and every one of us because we are all at risk. And that is why we keep saying that we must be each other's keeper. And we must take responsibility as Kenyans. We must take responsibility to take charge of our health and the health of others by protecting ourselves and protecting others. When it comes to blood, again, that responsibility and that desire to do common good, the compassion that is within us, we must light that up so that we are able to care about others, to be able, those of us who are able to provide, we do so. Blood doesn't cost much to give. It is a biological component of our bodies, But it is replaced very fast. And giving a pint of blood does not take a great deal from anyone other than the time that you take to be able to draw out that 1 pint of blood. So I think we need to appeal to each other, and we need to impress upon each other the importance of us acting collectively to be able to provide products such as this. Remember, blood is a product that is collected voluntarily. So we need to come out voluntarily and give out that blood. How then do we also reach out to people to come out? Well, as I said earlier, we need to look deeper and see what are the things that we can do that can bring people out or inspire people to come and donate blood. As we said, we are now going to be working using ICT platforms. Facebook is one of those groups that we are working with. An experience in other countries, Facebook has been able to mobilize its subscribers to be able to come and donate blood, not only during campaigns, but at any particular time, because they have the Facebook page and they are sent reminders, and then they are able to come out. So we will continue to explore other ways in which we can sensitize the population, sensitize particularly our youth bulge, because this is a country that has a huge youth bulge, and that is the bulge that is really on the social media. So we will leverage on some of these platforms to try to sensitize people to come out. As media too, I think you too have a responsibility. You have a responsibility, and I'm also appealing to you to use your platforms, to be able to get people to understand what it means to give blood. That blood can save lives. Curfew times. Shemtai, I think what you are asking is now that the curfew time has been, at least the curfew begin time has been pushed to 9 p.m., does that also mean that the time restaurants close has been extended? I would imagine that is natural, and that probably happens, although we may not have we may not have stated it clearly, but I think Dr. Kuria can talk on that. Home-based care. Whether we have, since we launched the guidelines for home-based care, which was on today's Thursday. That was on Tuesday, so it's only 2 days away. What is our experience so far? Let me allow also Dr. Kuria to respond to that question. Helen, home-based care too. Your question was particularly about the healthcare workers who are taking care of the home-based clients. There are several tiers of care that are provided to home-based cares. Of course, when you put somebody who is asymptomatic, does not show any symptoms, has not progressed to a point where they are beginning to show symptoms, they can be adequately taken care of even by a member of the household. And if you recall, we said that within the guidelines, there will be provision that people within the household, a caregiver in the household, could be appropriately trained in terms of the protective mechanisms that they use to be able to take care of that individual. If that individual, from monitoring by this caregiver, indicates that there is progression of that the individual is beginning to show symptoms, then that is at the time when a healthcare worker, qualified healthcare worker, will come in and assess the situation. As we said, the guidelines also has provision that if an individual who is on home-based care develops symptoms and requires to be hospitalized, that there is a referral system for doing that very rapidly. So those measures, those arrangements have been put in place to ensure that that can be done. We also talked about community isolation, if you remember, and we talked about community health volunteers. Community health volunteers are actually trained in many modules on health, on how to deal with health at the community level. They will be a part of this home-based care. And a module has actually been developed to train them, and they have been trained on COVID-19 and how to take care of COVID-19 patients or COVID-19 positive patients within their home settings. Then the last question was regarding the issue that the CS talked about in terms of human resources and certain difficulties in terms of moving people once they are posted. You know, we live in a very liberal democratic society, and people have their rights, and some people may decide to exercise their rights and move to different places to go and try to ensure that they are able to exercise those rights, and that they may not move if, for instance, they have been requested to move. We know cases where people have gone to court to get injunctions to prevent them from moving there. This is a broad issue that I think needs to be addressed, because in the public service, once you are employed, there is a provision within the appointment letter that gives the authorities within the ministry the leeway to be able to post people to different places as they deem it necessary. So there is that fundamental issue that needs to be looked at. And this is being discussed at those levels. And then, of course, there is a course of action or disciplinary course of action that can also be applied. I think all of these are being looked at as far as human resources and how to discipline and work with human resources is concerned. Let me allow Dr. Kuria now. You can see it's about to pour and we need to donate blood. Let me ask Dr. Kuria to say a word or two. And then I think we can all, including you, go in there and maybe each one of us give a pint of blood.
Thank you, Pastor Rashid. Chemtai, it was your question on restaurants operating beyond the curfew times. Thank you for your concern, and we wish every other Kenyan would be concerned like you. It is very concerning, actually. I was actually very concerned last weekend because I saw it myself. That the minute curfew was extended to 9 p.m., most restaurants extended their times to 10 p.m. And the activities in those restaurants were not what we anticipated the restaurants were going to be doing, serving food, but indeed they were serving alcohol. It's rather unfortunate. And although it has not been announced about the extension of restaurant operating times, I think His Excellency the President extended curfew time to give more time to those who want to do meaningful business do it. And as a ministry, we are reviewing the protocols in use for the operation of eateries and restaurants, and the reviewed protocols that are going to review those timings upwards are also in progress, and they will be released to the public in due course. I'm sure they are going through the final approval stages. But before they are approved, we urge Kenyans to again be responsible. Please close your restaurant at 4 p.m. as required by law. And we have instructed law enforcement officers to purge on those who are disobeying this. And it has already happened in a few of them. And as we said when we were launching the protocols, if we withdraw your permit, it is withdrawn permanently. So if your permit has been taken, don't bother reapplying. We will make sure it will not go through. So avoid enforcement officers purging on you because you are not obeying the times that were given. They will be reviewed, and if curfew has been reviewed upward, I'm sure even this is going to be reviewed, and the whole country will be opened up for economy. So we urge all those who are running restaurants to keep to the timings. It is still 4 p.m. so that we give the restaurant workers time to go home and beat the curfew still. Allow me also to talk about a few who are also flouting other rules of social distancing, especially in funerals. We've noted with concern again, we've gone back to our old times as though COVID has stopped. So although curfew has been lifted again, or has been extended, we have not extended our social distancing measures. They remain the same, and you are still again urged that for those attending burials, the requirement is that let not more than 15 people be in attendance. Again, we are working with law enforcement officers to enforce this. And as I say, and I keep saying, we shall not relent on those who break the law. So be on the lookout, because they are there and they are also watching. Alongside that, there was a question on any patients who have been on home-based care that have been discharged, purity. Yes, before home-based care protocols were launched, there was a pilot already being undertaken involving about 299 patients on home-based isolation and about 15 mothers who are breastfeeding. I'm happy to report today, yes, about 208 of them have been released from home-based care back to the society. They are safe, and they can interact with you. There's no need for stigmatization. They are as good as you are. So, yes, it's a success story that home-based care protocols can indeed work. Thank you.
Yeah, we go for...
Gakugeithia na gakunyita ugeni thiini wa tabarira ino iria tukoragwo tugikurehera mohiki mwaki makiriu maunduire witu wa Ugikuyu oro hamwe na magikurino.